Welcome back. Now we're going to learn about the lower respiratory tract. So remember, we are just below the vocal cords when we are in the lower respiratory tract. And so our first structure is the trachea, what you have called the windpipe. And when we look at the trachea, it has C-shaped cartilaginous rings where the C's are anterior. So if we do a cross section through the trachea, it would look like this. So in yellow, that is showing the piece of cartilage, and this opening is showing the space of the trachea. And the whole point of the cartilaginous ring, it prevents the trachea from collapsing down on itself. So you're asking, well, why isn't it a complete circle of a ring? Well, let's look to see what is behind the trachea. And behind the trachea, we have the esophagus. So the esophagus is soft tissue, so it collapses down on itself when there isn't food. And right behind the esophagus is your thoracic spine. So what has to happen is when you eat food, think of a piece of steak or a carrot or broccoli, and it goes down the esophagus, is the esophagus has to open up and it can't go into the spine. So the esophagus has to open up and take some of the space that is the trachea. And if the trachea had a complete circle for a cartilaginous ring, it wouldn't be able to do that. So that's why it's just a C-shaped piece of cartilaginous ring. All right, so here's what the lining, the epithelial lining of the trachea looks like. So look at this and see if you can figure out what the epithelium is, because we've covered epithelium multiple times. As we go through all these organ systems now, you should be able to look and figure out the epithelium. Do you notice that there are long cilia on the surface? And then look where the nuclei are. Try to figure it out. If you can't, here's a cartoon drawing to kind of help you. We've got cilia to move the mucus along the surface. We've got these single cell goblet cells interspersed, and then look at the nuclei up and down all over the place. Were you able to figure it out? That's right. This was a pseudostratified ciliated columnar epithelium. Fantastic. This is our normal respiratory epithelium. It's what we had in our nasal cavity. It's what we're going to have in a lot of our respiratory tract. Continuing along our pathway, once we get to the lower border of our trachea, we are going to go into what we call our bronchial tree. So we will divide into two. Our first bronchus is going to be called our primary bronchus. We have one on each side. It is green in this picture. Then each primary bronchus is going to divide into what are called our secondary bronchi. And then the secondary bronchi are going to divide into our tertiary bronchi. Now, you don't need to know how many secondary or tertiary bronchi there are. Just know that after the trachea, we have our primary bronchi, then our secondary bronchi, then our tertiary bronchi. And there are only two primary bronchi because there's one for each lung. After the tertiary bronchi, we're going to have about 14 more divisions. And the good news is you don't have to know the names of most of those divisions because we're just going to call all of those bronchioles. Okay, so trachea, primary bronchus, secondary bronchus, tertiary bronchus, and then just bronchioles until we're going to get to our last thing. Okay. Now, as we are traveling among our bronchi, we are losing the amount of cartilage we have. So in our trachea, it was a C-shaped piece, and then it just became little random plates of cartilage. And then by the time we hit our bronchioles, we essentially are not going to be having any cartilage anymore. And you can kind of see this in this picture because the bronchi are nice and firm, but all the bronchioles, they just kind of collapse down on themselves. Okay. So yeah, it's called the bronchial tree because it kind of looks like if you turn it upside down, it would look like the branching of a tree, where the trachea would be the trunk. So as the branching goes on, the bronchioles have lost cartilage, but what they have gained is smooth muscle. Okay, and it's not solid walls of smooth muscles, it's strips of smooth muscle. So now you're thinking, oh, okay, so the smooth muscle is going to keep it open. I'm going, no, stop and think what smooth muscle does. Smooth muscle contracts. So is that going to keep a bronchial open? No, when it contracts, it's going to make it narrow. So if you've got some irritation going on in the bronchial, it's going to contract it and prevent airflow from happening. Yeah, so here is a picture of a bronchial with that ciliated pseudostratified columnar epithelium, and you have some smooth muscle. Okay, you can see it's not a complete wall of smooth muscle. It's just strips of smooth muscle going on. And eventually the bronchioles are going to lead their way to these structures, which you can see, these little round structures. Okay. But let me step back for a second and talk about the lung as a whole. In the right lung, we have 3 lobes, which you can see clearly here. But in the left lung, we only have 2, and that's because we have the heart, which takes up a certain amount of space on the left side of the chest. So if you notice, the primary bronchi enter the lungs on the middle aspect, the medial aspect, what's called the hilum of the lungs. And not only is this where the airways enter, this is where blood vessels enter and exit. And it's also where lymphatics are going to enter and exit. So it's where everything goes into and out of the lungs. Just this one general area. So nothing is going in anywhere else on the lungs. If we look at the lungs, they are surrounded by the pleura. Okay, so if we look at pleura, hopefully you remember there are 2 layers. On the surface of the lung itself, the organ is the lung. So we take the word meaning organ, viscera. So the lung is covered by the visceral pleura. And then the ribs are going to be covered by the parietal pleura. If you've ever eaten baby back ribs, here's a picture of baby back ribs, and you pulled off that membrane, as is being shown in this picture here, that membrane is the parietal pleura. So between the visceral pleura and the parietal pleura, that's where the pleural cavity is. Okay, so the lungs are not in the pleural cavity. Students get confused and they think the lungs are in the cavity. They are not. The pleura surround the lungs and they attach to the bronchi, and then they attach to the diaphragm down below. And that pleural cavity contains a small amount of lubricating fluid. So once again, when you are breathing, it decreases the resistance. All right, getting back to the airways. After all those bronchioles, we get to those little spaces. So think of this kind of like grapes. So, you know, if you have a bunch of grapes and you've got the little stalks and eventually have the little tiny stalk, which leads you to the one little grape, each little grape would be an alveolus. And in your lungs, you've got 300 million alveoli. So each one of these would be a grape. Okay. And when we look at your alveoli, here's the remnants of the smooth muscle coming from the bronchioles, but most of your alveoli are not going to have smooth muscle around them, but what they are going to have covering them are capillaries. Okay, and that's because the alveolus is the site for most of our gas exchange. Yes, the terminal bronchioles can do a little bit of gas exchange, but for this course, we're not going to worry about that. We are going to be talking about the alveoli doing the gas exchange. And so let's look at this alveoli up close, and on a higher power, you can see here's an alveolus. And if we did a cross section through one of these, you can kind of see at every corner, we can see the little red blood vessels inside the capillaries, each of these little corners. So let's take this and do a cartoon drawing to see what various cells we have going on in an alveolus. So then we can put them to work and see what exactly is going on. So in this alveolus, this is an alveolus, here's an adjacent one, another one, and you can see the opening between alveoli right here, and that's what these little holes are meant to show, is opening into other adjacent alveoli. As you can see, the majority of cells are going to be these rose-colored cells, and so these cells are called type 1 alveolar cells. Why? Because they were the first ones to be named. And these are the cells that are forming the epithelial lining, which, if you look at them, they look like fried eggs. So these are a simple squamous epithelium, the thinnest type of epithelium. And you can see that right here. Do you see how thin this is? And there's the nucleus bulging, and there how thin it is. And so the function of this cell is going to give us rapid gas diffusion. Nothing new there. The second cell we're going to look at is this green one here with the little ruffled border, kind of looks like an Oscar the Grouch if you look at it. And this is called a type 2 alveolar cell. So yeah, we didn't come up with any crazy names here in the alveolus. And what this cell does, it secretes something super important called surfactant. And surfactant starts being secreted in about the last month before you were born. And its function is to decrease surface tension. And you're going, okay, that's great, but I don't have a clue what that means. And what this is, surfactant is it's a chemical which is going to coat the inner surface of the alveolus. And what this is going to do is when you exhale, it's going to keep the alveolus from fully collapsing. So think for a second, have you ever blown up a balloon? So the hardest part when blowing up a balloon, like if you're blowing up balloons for a birthday party, is starting to blow it up, breaking the surface tension. Once somebody has started it, it's easy to blow it the rest of the way. So the surfactant is keeping it from collapsing all the way down. So it's only going to collapse down, 70%. So with the next breath, it's very easy for the air to come in. All right. And so this was the problem with premature babies. They hadn't started secreting surfactant. And so now if a mother goes into premature labor, there's a medication we can give her to help the baby start producing the surfactant. And now there actually is an artificial surfactant we can secrete down the baby's breathing tube to help them do that. And this was a major change in increasing survival of preemies. And the third cell, this blue cell right here, is just an alveolar macrophage. Okay, it's a Roomba vacuum cleaner. Because you remember how we said this was supposed to be sterile down here? Well, in case it's not sterile, this alveolar macrophage is going to do its job. And it's going to do phagocytosis of anything it finds down here that doesn't belong. So let's go back and look at what's happening between the capillary and these type 1 cells. And so remember, this is a red blood cell here inside the capillary. And we're going to look at this right here, what is called the respiratory membrane. And so what the respiratory membrane is made of is the plasma membrane of this type 1 alveolar cell and the plasma membrane of the capillary endothelial cell, which was also simple squamous. Remember, capillaries have only a simple squamous endothelial cell, but remember, capillaries also have a basement membrane, and the alveolar cells also have a basement membrane, but here the only place in your body where they are going to share a basement membrane. So it's going to be fused between those two cells. Be right here. So this is the thinnest membrane in your entire body. It's as thin as 0.1 micrometer. Pretty dang amazing, isn't it? And so this is really going to promote rapid gas movement across this membrane. So speaking of gas movement, here's how it happens. They're lipid soluble. So in this capillary bed, we do not need the entire length of the capillary bed for oxygen to leave the alveolus and enter the capillary for carbon dioxide. Most of that gas exchange happens in the first 25% to 1/3 of that capillary bed. So we don't need the entire part of it. Now, that's if everything is normal. If you have your normal type 1 cells and your normal type 2 cells and alveolar macrophages keeping it clean. But what happens if something goes wrong? If you have an inflammatory process going on there? Well, if you have an inflammatory process with your cytokines and you have debris and you have an inflammatory reaction with fluid in there, and if you have, like, say, for instance, neutrophils or any other kind of macrophages and you have necrotic cells, well, then you're going to have pus and you're going to have a whole bunch of macrophages in there, and you're not going to have that gas exchange going on in there. You're going to end up with fluid in there. So that's not going to be a good thing. So here's the last thing I want you to do, because we are done with our air pathway. So take some time, start at the nose, okay? Write out the air pathway, all the parts that we have talked about, all the little details. Use the real terms. Don't write things like windpipe, throat. Use all the real terms and all the divisions of those terms, okay? Yes, write them all out. And when you're done, go back and check yourself. And I will see you when we come back for our next video, where we're going to talk about mechanisms involved with breathing. So thank you so much, and I will see you shortly. Did you catch those answers really quickly?